A devastating public health crisis has emerged in Pakistan, where an undercover investigation has revealed that unsafe medical practices at a government hospital may have contributed to a large outbreak of HIV infections among children. The findings have raised urgent questions about infection control, healthcare accountability, and systemic failures in the medical system. Hello, my name is Ashutosh Srivastav, and I bring you the best from home and abroad. At the center of this investigation is the THQ Hospital Taunsa in the Punjab province of Pakistan. According to the investigation, the hospital has been linked to a cluster of at least 331 children who tested positive for HIV between November 2024 and October 2025 in the city of Taunsa. The human cost of this outbreak is devastating. Among the affected families is that of 8-year-old Muhammad Amin, who died shortly after testing positive for HIV. His mother described his final days as filled with severe pain and suffering. Shortly after his diagnosis, his younger sister Asma also tested positive. Their family believes both children contracted the virus through contaminated injections during routine treatment at the government hospital. Asma, now living with HIV, faces not only the burden of lifelong medical treatment but also social stigma. Her family reports that she is isolated from other children as neighbors fear infection. Her simple question, "What is wrong with me?" captures the emotional toll of the outbreak beyond the medical crisis. The investigation found that most of the children affected had no HIV-positive parents, strongly suggesting that the infections were not caused by mother-to-child transmission. In a sample of tested families, only a very small number of mothers were HIV positive. Instead, the public health data from provincial screening programs indicated that in more than a half of the cases, the suspected cause was contaminated needles. What makes this case particularly alarming is the evidence uncovered during 32 hours of undercover filming inside the hospital. Journalists documented multiple instances of unsafe injection practices, including the reuse of syringes on multi-dose vials of medication and the administration of injections without proper sterile precautions. In several cases, syringes were reused in ways that could contaminate entire vials of medicine, potentially exposing multiple patients to infection from a single contaminated source. Experts say that even if a needle is changed, the syringe body itself can still carry blood-borne viruses, making such practices extremely dangerous. Medical experts who reviewed the footage described it as a serious breakdown in infection control. A consultant microbiologist noted that these practices could directly transmit HIV and other infectious diseases between patients. Other scenes showed nurses handling medical waste without gloves, retrieving used syringes, and administering injections in unhygienic conditions. The investigation also revealed broader systemic issues. Many hospitals in the region reportedly face shortages of medical supplies, including basic medicines and sterile equipment. In such conditions, healthcare staff are often forced to reuse materials or cut corners, increasing the risk of infection spread. Experts also point to a deeper cultural and structural issue: the overuse of injections in Pakistan's healthcare system. Many patients prefer injections over oral medication, even when not medically necessary, and doctors often comply. This high demand, combined with limited resources and weak oversight, creates conditions where unsafe practices can become routine. The team also found that despite earlier warnings and official promises of reform, unsafe practices continued months after the outbreak, which was first identified. This raises serious concerns about enforcement of infection control standards and accountability within the healthcare system. Hospital officials, however, have denied the allegations. The current medical superintendent of THQ Taunsa questioned the authenticity of the undercover footage and suggested that it may have been staged or outdated. He insisted that the hospital maintains proper safety standards and that prevention of infection remains a priority. But public health experts and investigators argue that the evidence points to a deeper systemic failure rather than isolated incidents. They warn that similar outbreaks have occurred in other parts of Pakistan in recent years, including cases where hundreds of children were infected due to unsafe medical practices in clinics and hospitals. In response to growing concerns, government authorities and international health organizations have acknowledged the need for stronger infection control measures. However, critics say enforcement remains inconsistent and unsafe practices continue in some healthcare facilities. The outbreak in Taunsa is now being seen as a warning sign of a broader public health vulnerability. It highlights how weaknesses in basic medical hygiene training and oversight can have devastating consequences, especially for children. Ultimately, this crisis is not only about one hospital or one city. It reflects a larger challenge, ensuring that healthcare systems, even under pressure, uphold the most basic standards of safety. For families like Asma's, the consequences of failure are lifelong. As investigations continue, the central question remains unanswered. How many more children must be affected before systemic change is enforced? Thank you for watching.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.